Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Pain and limited movement are the biggest reasons for a hip or knee replacement. But at what point should a person have surgery? Today we'll get the answer to that question and along the way learn all about hip and knee replacements, including the process, the risks, and the rehab. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay tuned. Welcome back. Today we are talking with Dr. Kerry Hale about hip and knee replacements. Welcome to our show, Dr. Hale.
Thank you.
Thanks for being here. So let's just dive right in. Can you start out by telling us what is osteoarthritis?
Osteoarthritis is a degenerative condition that can happen to most of us actually as we age. It's just a regular wear and tear of the joints themselves. So the cartilage wears down.
Okay, so this is something that may lead to a knee replacement surgery?
It can, yes.
Okay, what are some of the other reasons why someone may need a knee replacement surgery?
Well, arthritis can occur from not only the regular wear and tear osteoarthritis, but inflammatory arthritis such as rheumatoid arthritis, gout, those types of conditions. People can also have what's called post-traumatic arthritis. So say an ACL or meniscal injury when we're younger can lead over time to what we call this post-traumatic arthritis.
Okay, and if someone is experiencing these kind of conditions or pain, is surgery usually the answer, or are there other alternatives that might come up?
There are definitely other alternatives first before surgery. Patients can go through physical therapy, strength training programs, modifying their activities. There's a whole host of different medications, both pain relievers and anti-inflammatories that we can use. And then there's certainly a role for injections in joints occasionally to help. So a number of different things that can be done.
Okay. And I know there are people, lots of times, they'll live for years with knee pain, or maybe their knee isn't as mobile as it used to be. What's the tipping point there where it's time to get them in for surgery?
So every patient is different.
Sure.
And every situation's a little bit different. I like to tell my patients that the time to consider joint replacement is when their pain and their dysfunction in their daily life is enough where they've had it, and they've been through conservative therapies, and they're ready.
And so there are different types of knee replacement that you can get, right? Can you talk a little bit about those different types?
Sure. So there's sort of what we call a full knee replacement. We divide the knee into 3 different compartments, and that's a replacement of all 3 compartments. And that's the most typical replacement that's done here in the United States and worldwide. There's another replacement called a unicompartmental arthroplasty, which actually only a small percentage of patients would be eligible for, because typically that's arthritis in just one compartment of the knee, whereas usually there's arthritis in more than one compartment.
Okay.
So.
Okay, are there, will someone who get this surgery just see vast improvements, or what is the improvement like once you have a knee replacement?
It's a big surgery to get through, and I tell people that they may wonder for the first few weeks, sort of after surgery, what they did get themselves into. The recovery time typically by about 6 weeks to a couple of months, 3 months out. Patients are doing fairly well, but with a knee replacement, you'll see small, steady improvements for an entire year after surgery.
Okay. And what exactly happens during knee replacement? Is there mechanical things that are put in there, or can you just talk a little bit about the procedure?
Yeah. So both sides of the joint, the femur, the thigh bone, and then the tibia, the larger bone in the leg, basically using a series of jigs, the arthritis is cut and planed off. So all of the cartilage is taken off, along with a small amount of bone, making nice, smooth surfaces for the implants to fit very precisely onto.
Okay, and you already talked a little bit about the recovery time and seeing improvements. Is there a typical time that people will expect, or does that depend on the patient too?
In terms of the recovery time, yeah, so typically about 6 weeks, 2 to 3 months, patients are doing quite well, and they're back to the most of the activities that they like to do. They'll continue to see, again, some small improvements after that for the first year.
Okay, and are there preparatory things that people need to do before the surgery to kind of ensure that that recovery takes place how it should?
So if patients can, what we call prehab, meaning if they're able to do some sort of strength training, weight-bearing exercise before surgery, it will help immensely in terms of speeding their recovery afterwards. Sometimes that's just not possible because if the knee hurts enough, then you're just not able to do much on it. But we try to encourage patients to be doing as much as they can in preparation.
Okay, are there times when people are experiencing these kind of pains or conditions but still wouldn't be a good candidate for knee replacement surgery?
If a patient had a significant other illness or illnesses where it may not make it safe for them to undergo anesthesia or pretty substantial recovery, those would be the instances where surgery wouldn't be recommended.
Okay, is age ever a factor?
Less so now, for sure.
Great.
Okay. It's really on kind of your overall health and instead of the age.
Because the age is only a number, as
yeah,
I always
yeah.
say. Exactly. Okay, we need to pause here for just a quick break. But when we come back, what else you need to know about knee replacement surgery, and we'll also take a look at hip replacement surgeries too. So stay tuned. We'll be right back after these messages.